Hi, it's Bridget with Sleepopolis, and today I want to talk about menopause and sleep. So we brought in our Director of Sleep Health, Dr. Shelby Harris, to talk more about it and how it can impact your sleep. What are some common problems experienced during menopause?
So during perimenopause, that can start for some women as early as the late 30s, and people don't even think about that being an issue. But it's very common to start mid-40s, even early 40s. The symptoms that you start seeing can range drastically for women, but the common sleep symptoms we see the most would be things with hot flashes or awakenings from hot flashes, night sweats, nighttime anxiety, and depression as well. We'll see more fatigue during the day. And one other symptom, or actually sleep disorder that we see a lot develop in this age range, is sleep apnea. So we'll see sleep apnea, which is some snoring, but it can be very light snoring, pauses in breathing that people might not notice. And that can cause fatigue as well, as the hormones that are now changing and your airway is loosening. And then one other sleep disorder we see a lot is restless leg syndrome. So that's actually where your legs or your arms, or all of them, are getting very restless, and it makes it harder to fall asleep as the night gets closer.
How long do these symptoms typically last?
It varies, unfortunately. Some people will have a symptom here and there or none, and it'll be done. Other women, 5 years, 10 years is kind of on the long side, but yeah, it can happen for a long time.
What are some good tips for getting good sleep during this time?
So the biggest thing that I always recommend to women, especially because of the hot flashes and the night sweats, those are the biggest things that people complain about, are sweat wicking pajamas, sweat wicking and cooling sheets, cooling mattress pads. Anything cool and sweat wicking is the name of the game. So there are really wonderful mattress toppers that you can buy now that you can set for certain temperatures that will cool the whole mattress that you're sleeping on, and they are perfect for this age range especially. Keeping your room really cold is really important. So even if you're cold at bedtime, your body still wants to get even a little colder at night. So maybe sleep with some socks on if you have to, but eventually it's gonna all even out as the night goes on because you wanna have it cold. Other things to think about are alcohol. That can worsen hot flashes, so really try to limit alcohol in the evenings. Caffeine, spicy and heavy foods can also worsen the hot flashes and night sweats. Make sure you're moving during the day, getting some exercise and light exposure, because that's really important. And if that's not enough, then I recommend people to actually talk to their gynecologist, see if there are other treatments. There's hormone treatments that are really impressive. Cognitive behavior therapy takes the sleep hygiene even further and is really very strongly recommended. So don't suffer. We have really good treatments for this age range. So for the anxiety, it's a lot of just working and doing things all day long and then just stopping your brain at night and trying to go to sleep. And of course, it's all gonna pop up. So I usually recommend trying to start a meditation practice if you haven't already, journaling, writing a to-do list, and making sure you have a buffer of at least 30 to 60 minutes to just kind of quiet your brain down, like it's a dimmer switch, not an on-off switch. It's really important to set the stage for sleep to help. Meditation is really useful to help quiet that busy brain, but people think it's a bigger thing than it need be. Start with a minute of just looking out the window every morning. That's what I do. Just look outside, observe and describe what you see, and if your mind wanders, say, no, not now, back on observing and describing. There are wonderful apps out there that I think give people a little bit more focus on what they need to be doing. But the whole goal of a meditation practice is to notice when your mind wanders and get back on track. But start small. Start with 1-2 minutes a day, and then when you get better, you can start doing 5-10 minutes. It doesn't need to be a half hour every day or twice a day. Do something that works for you. And if you put in the effort every day for a little bit, you're gonna start seeing in a few months' time that it's gonna start helping you to quiet your brain. It's not the sort of thing where you'll start seeing results after a day or two or even a week or two. It's like going to the gym. You're getting stronger and stronger every day, and after a few months, you'll start to see the results. And if these things aren't enough, definitely talk to your doctor about other treatments, because pharmaceuticals, psychotherapy, hormone replacement therapy, there are a lot of different options available to help with anxiety, mood issues, and then the sleep issues that go along with them.
Okay, if you have any more questions about this and want to learn more, just click the link in the description below. You can also head over to sleepopolis.com for more sleep health information.